Hello, Assalamu alaikum. In this video, we will understand about the oral contraceptive, the pregnancy prevention pills. In this video, we will understand about how pregnancy pill will work. So let's understand about the whole mechanism and understand the basically is the female reproductive system. So the pregnancy pills basically estrogen or progestin collectively are estrogen and progestin combined pills. Only progestin or estrogen can be possible. So different basically type of the drug can use. So estrogen and progestin is the drug which that used for the inhibition of the pregnancy. Side effects. So it can be headache, nausea, breast tenderness, and mood change or mood swing. So a lot more other complication will occur due to the chronic use of the oral contraceptive, the pregnancy prevention pills. So in this way, let's understand about first the reproductive system of the female contain two fallopian tube, two ovary, and the cervix, vagina, and endometrium. Endometrium contain basically is the blood circulatory system containing thickness and thinning with the passage of the menstrual cycle. We will discuss ovary later, but first of all, you should understand the hypothalamus, which that receive the stimuli, different type of stimuli, to activate the pituitary gland. So, to activate the pituitary gland to release the follicle stimulating hormone and luteinizing hormone. Follicle stimulating hormone is important for the maturation of primary follicle. By follicle stimulating hormone, it will be mature. Primary follicle activate. The primary follicle activate to proliferate and differentiate into the secondary follicle. The secondary follicle should be one. So it can be 2, 3, or 4 depending on the situation, but mostly one, because uh, chance of the releasing of one for fertilization only single baby. So secondary follicle will further progress due to the luteinizing hormone, and luteinizing hormone will work for the ovulation, release of the egg into the fallopian tube. Remember, when egg will release, ovulation will lead to left behind. The structure is known as the corpus luteum. This is the glandular yellowish structure which that support the pregnancy throughout the period of the pregnancy and completely. So the different stimuli, basically environment, food, and health, as well as puberty and age, which that stimulate the hypothalamus will maintain and give the signal to the pituitary gland to release the follicle stimulating hormone and luteinizing hormone further. But the corpus luteum will produce the estrogen and progesterone more and more to inhibit the follicle stimulating hormone and luteinizing hormone for further primary follicle maturation. In this way, the primary follicle further not mature. In this way, the pregnancy will maintain, but no other primary follicle will release. In this way, the single pregnancy can be possible by this mechanism. Progestin only will work for the mucus on cervix to thin, and thinning of endometrium and more difficult to pregnancy due to the thinning of the endometrium, because the endometrium should be thick due to the estrogen and progesterone. So in this way, the progestin will inhibit this thickening. Estrogen and progestin will also inhibit the egg ovulation. How? Because it will inhibit the luteinizing hormone and the follicle stimulating hormone, obviously. So in this way, the estrogen plus progestin combinedly will inhibit the maturation of primary follicle by follicle stimulating hormone inhibition. In this way, follicle stimulating hormone inhibition will lead to inhibit, while the luteinizing hormone inhibition lead to ovulation prevention. Both these mechanisms work differently with the different drugs. So in this way, the contraceptive work by this mechanism. I hope you make sense about that. So the complication can be heart attack or stroke, blood clots of bones, weakness can be possible, vascular health problem, aging in female also possible. So I hope you make sense about that. The oral contraceptive, the pregnancy prevention pills. See you in the next video. For this time, bye. Allah Hafiz.